Group is Vanessa, Melissa, and Jamel, and we will be assessing the cervical spine. So to begin, we will be doing some palpation, and she will palpate the angle of the mandible and the masseter.
So I'll be checking for the 4 T's in palpation: temperature, tone, texture, and tenderness. So I'm just going to feel around the cervical spine. The temperature seems normal on both sides. The muscle tone is normal, no hypertonicity or hypotonic muscles. And in terms of texture, it's also normal. There's no bulkiness. And do you feel any tenderness in the spots I'm palpating right now? No. Okay, perfect.
Next, we will be doing rule-outs of the joints above and below. We will start with the TMJ.
Okay, so just rule out your TMJ, what I'm going to get you to do first is just to open your mouth. Do you feel any pain there? Okay, so I want you to apply a downward pressure as you're opening your mouth. Any pain there? No. Okay, perfect. So the next thing we're going to do is to retract your jaw. So I want you to bring it inward like that. Any pain there? Yeah. No. Okay, perfect. So the next one is protrusion of the jaw. So I want you to protrude your jaw out. So bring it out. Any pain there? No. Okay, and we don't apply any overpressure on the retraction protrusion. And for the last one is elevation. So I want you to close your mouth. Do you feel any pain there? No. All right, and then I just want you to clench your jaw for the overpressure. Any pain there? Okay, so we've ruled out the TMJ. And then for the next rule out, we're going to rule out the shoulder. So we're just going to do 2 motions, and you're going to do it actively, and I'll apply overpressure as long as there's no pain. So if I can get you to stand up, actually. Okay, so palms facing inwards, I just want you to bring your shoulder out like that. Any pain there? No. Okay, so I'm just going to apply a bit of overpressure. Any pain there? No. Okay, so for the next one, same thing, palms at your side, and then just bring your arm up to the side like that. Any pain there? No. Perfect. Apply a bit of overpressure. Any pain? No. Okay, and we're going to do that with the opposite arm as well. So the first one, flex forward. Any pain there? No. Okay, apply overpressure. Any pain there? No. Okay, and then the second movement, abduction. Any pain there? No. Okay, apply a bit of overpressure. Any pain? Okay, so we've ruled out the shoulder and the TMJ.
We will now do active range of motion. We will begin with flexion, and normal range is 80 to 90 degrees.
Okay, so what I'm going to get you to do for this one is just to bring your chin to your chest. Any pain there? No. Okay, so I'm just going to apply a bit of overpressure, so go back up. Any pain? No. Okay, so that's well within normal range. I would say that's about an 85 degrees of flexion.
Next, we will do extension. Normal range is 70 degrees.
Okay, so what I want you to do is just bend your neck backwards. Right. And so I'd say that's about a 70 degrees, which is well within normal range. We don't do overpressure on extension.
Next, we will do rotation. Normal range is 70 to 90 degrees.
Okay, so what I want you to do is just to turn your head to the right. Any pain there? No. So apply a bit of overpressure. Okay, and then rotate your head to the other side. Any pain there? No. Apply a bit of overpressure. Any pain there? No. Okay, so both sides were relatively normal. I'd say that's about 80 degrees of rotation.
Finally, we will do lateral flexion. Normal range is 20 to 45 degrees.
Okay, so for this one, I want you to side bend your neck to one side. Any pain there? No. Apply a bit of overpressure. Any pain there? No. Right, and then bend to the other side. Any pain there? No. Apply a bit of overpressure. Any pain? No. Okay, so that's still within normal range, and I'd say that was about 25 degrees for both sides of lateral flexion.
We will now do passive range of motion. This is best done supine.
Okay, so if I can get you to lie down on your back, and for this one, I'm going to be doing all the actions for you, and I just want you to relax, okay? All right, so first we'll be doing flexion. Do you feel any pain there? No? All right, so that's a tissue stretch, an extension. Any pain there? No. Okay, that was a tissue stretch as well. Rotation of both sides. All right, tissue stretch for rotation, and last is lateral flexion of the neck. Any pain there? No. Okay. Any pain there? No. Okay, so that was tissue stretch for lateral flexion as well. So you can just go back down the table.
We will now do resisted isometric movements.
Okay. Okay, so for this one, we'll start with flexion first, and what you're gonna do is try and bring your chin to your chest, and you'll meet my resistance for 3 seconds, okay? If you feel any pain at all, just let me know, okay? So flex forward, 1, 2, 3. Any pain?
Nope.
Okay, now we're gonna extend the neck, so just apply pressure, 1, 2, 3. Any pain?
Nope.
Okay, so rotate to this side, 1, 2, 3. And this side, 1, 2, 3. Any pain on both sides?
No.
Okay, and last one we're going to do is lateral flexion. So side bend to the side, 1, 2, 3. Other side, 1, 2, 3. Any pain there? Okay. So for the grades for flexion, extension, rotation, and lateral flexion, it was a grade 5 for all of them because they were strong and pain-free.
We will now be doing a dermatome test, and we will do the upper quadrant scan.
Okay, so this one I'm going to get you to go seated again. And so for this one, I'm going to be running my fingers down your upper limbs. And what I want you to do is just to report any altered sensation or pain. Okay? So I'm going to in. Is it okay if I go ahead and test? Any difference? Any difference? Anything? Any altered sensation? No? Okay, perfect. So for the upper quadrant scan, she tested normal. There was no altered sensation or diminished feelings.
So we will now do a myotome test testing C7, which is wrist flexion and elbow extension.
Okay, so for this one, I'm going to do bilaterally, and we'll start with the right side. So for the first one, I want you to bend your wrist upwards, and I'm going to apply resistance to it, and you want to hold it for 5 seconds. But if you feel any pain, let me know. Okay. So flex your wrist for me. 1, 2, 3, 4, 5. Any pain there? Okay, we're going to do it on this arm. 1, 2, 3, 4, 5. Any pain there? Okay. And then the next one, we're going to do elbow extension. So you're going to try and straighten out your elbow, and I'll apply a resistance to it. Okay. So go. 1, 2, 3, 4, 5. Any pain there? Nope. Okay. So this one. Okay. 1, 2, 3, 4, 5. Any pain there? Nope. Okay. So for her myotomes, everything was strong and pain-free.
So we will now do a reflex test, testing again C7, the tricep reflex.
Okay. So I'm just going to dangle your arm like this, and just want you to relax. This up. All right, so just dangle. All right. So that was about grade 2, which is normal for the tricep reflex.
We will now do special tests. We will begin with Jackson's compression test.
Okay, so the purpose of Jackson's is to check for cervical radiculopathy. So what that means is that if it's positive, there will be pain radiating down the same arm of the side that the head is rotated to. A negative would mean that there's no pain radiating down the arm. So what I'm getting you to do is just to rotate your head to the right, and then I'll apply a force straight down. If you feel any pain going down this arm, let me know, okay? Any pain? No? No? Okay, perfect. And then rotate to the other side for me. The same thing. Any pain on this arm? Let me know. Okay. Anything? No? Okay, no pain. So she tested negative for Jackson's.
So we will now do the scalene cramp test.
Okay, so the scalene cramp test, the purpose of this is to check for possible thoracic outlet syndrome or problems in the brachial plexus. So for this one, I want you to start off on the right side. So you're going to tuck your chin into just the hollow above the clavicle, the collarbone here. Okay. And then you should, if you feel any pain down the right side of the arm, let me know. No. Anything? No. Okay. And then you're going to do it to the left side. Just tuck it in. Any signs going down the left arm? No. Okay. So she tested negative for this because there was no reproduction of the symptoms. A positive would indicate if there were radicular signs going down the arm.
30 seconds.
All right, so for the clinical findings, everything was normal in terms of active, passive versus isometric movement. The dermatomes, myotomes, and reflexes were also normal. But for further special testing, we can also always do ADSENS just to rule out TOS or something else. But for today, massage is indicated, and we will proceed with the treatment and we'll assess you again